Welcome, everyone, to this very first episode of our new series, Field Notes. I'm Brad Pupper on the Medical Office Communications team at Fresenius Medical Care North America, and your host for this discussion today. We are incredibly fortunate to have access to many experts, researchers, physicians, and caregivers who all bring experience, compassion, and insight into the work we do every day to deliver superior care to our patients. We hope this series will get you to think about some new topics and issues and provide useful information that will help you in your work every day. Most importantly, I hope we can have some fun doing this as we learn and discuss these topics together. Yes, we'll be talking a lot about kidney disease, but also other topics that are timely and relevant. Right now, more than ever, we know the importance of physician partnerships and honor all our clinicians on the front lines as we mitigate and respond to the COVID-19 pandemic. The job can be stressful in normal circumstances, and now you add on a pandemic, and it can be even more challenging. So we thought we would invite Felicia Speed onto the program today to discuss the real issue of physician burnout. Felicia is our corporate social worker at Fresenius Medical Care and someone who's always able to stay positive, even in tough times like these. Felicia, welcome to this very first edition of Field Notes.
Thank you. Thank you for inviting me. Glad to be here.
Yeah, it's great to have you. Let's just start with, tell us a little bit in your experience, how you define physician burnout. What are the signs? How do you know if you're burnt out?
Some of the signs that I have learned over my time of reading and having time with various physicians across the country, whether I'm dealing with patient-provider conflicts or what have you, or just working with them directly on various projects or with just direct patient care, some of the things that I've identified is just seem to be a little bit more cynical, I guess you could say, a little bit more sarcastic. When you look at Maslow burnout inventory subscale, they have three components, which is depersonalization, emotional exhaustion, and lack of personal accomplishment. So when I look at that and I think about some of the physicians that I've come in contact with, one big one is that emotional exhaustion, where and also depersonalization, where they just don't seem to have that same connection, with our patients, or looking for opportunities not to have contact or connection with the patient. They become very involved with the treatment and the procedure, but they lose sight of the person that's behind that.
So you lose that empathy that we need so much from our physicians.
Yes, and there's another term that's often used called compassion fatigue, where when you're dealing with very, I hate to say needy, but very sometimes demanding patients, it's one thing just to have an office visit where you may see them once every 3 months, but in a dialysis facility, sometimes our physicians can see our patients once a week. So you're having to see the same group of patients, every week for sometimes years. And that you get to a point where there's compassion fatigue, when you don't see changes in behavior, you don't see improvement, the issues continue to be the same. And those are some of the things that can lead to some of the physician burnout, along with just simply the clinical practice, clinical medicine, working with patients every day, lack of work-life balance. So their personal life, not having a balance with that. And just, physicians, I think, just learning medicine and going through all of the classes and courses and internships and residencies, they've taught themselves to sort of it's been drilled into them to be superheroes, right? Mm-hmm. So they have this like superhero syndrome where they're not supposed to be weak. They're supposed to always be strong, work 20 hours out of 24 hours. And so they don't really know how to turn that off once they've accomplished, all of their degrees and received their licensure and they're working in their offices or working with patients. And then they're at this place where they need to start to have some balance, and they have difficulty being able to do that.
I really want to thank you for taking time to discuss this important topic, especially right now. And you've been listening to Field Notes by Fresenius Medical Care. Take care, everyone. Stay safe.